So Medicaid is actually the largest public health insurance program we have in the United States. It's larger than Medicare, which covers seniors. Medicaid, working with its sister program, the Children's Health Insurance Program, covers almost 80 million Americans. Depending on where you live in your state, 40 to 50% of children are covered by Medicaid. 40 to 50% of births are covered by Medicaid. It's also the largest payer for substance abuse treatment and covers millions and millions of low-income families, people with disabilities, and low-income seniors. Medicaid is paying for the majority of seniors who are in nursing homes, and it also does a lot of work covering home and community-based services. 20% of seniors on Medicare also have Medicaid to help make it work for them. Pays their cost sharing, it covers benefits like dental that's not covered by Medicare. So it makes Medicare work too. Medicaid is vitally important everywhere, but it's especially important in rural communities. We just did a recent report, and for children and adults, they're actually more likely to be enrolled in Medicaid in rural communities, which speaks to why some of the very major threats we're seeing to Medicaid right now and that we expect to come down the line from Congress are of critical importance for everybody to understand, but particularly rural communities. The majority of the funding is from the federal government. So this is a combined federal-state program. The federal government does provide the majority of funding and sets both rules and standards for who should be covered, what benefits they get, but states run the day-to-day of the program. Another really important thing to be aware of is that Medicaid is the largest source of federal funding coming to states. So state budgets are very much at risk here. If Congress makes large cuts to Medicaid as they're contemplating, this will throw state budgets into havoc. And no state is able to raise taxes enough or cut services enough to manage their way out of the kinds of cuts that are being contemplated today by Congress.